Well, I'm really excited and delighted to be here today to open up this patient advocacy panel. My name's Daniella Nunez, and I work at Consumers Union. And I traveled from Texas to Kentucky to be here today and to introduce my colleagues on patient advocacy and also to tell you a little bit more about the Safe Patient Project. Consumer Reports was founded in 1936, and we have a long history on working on a range of consumer protection issues. And Consumers Union is the policy and advocacy arm of Consumer Reports. And we work on everything from financial services to product safety to food safety, healthcare and energy, telecommunications. We have a million online activists, people that take action on issues that we work on. We've also collected over 130,000 consumer stories on all of these topics. And we're really active on healthcare. We have a number of healthcare websites and properties and projects, the Safe Patient Project, the Consumer Reports Health Rating Center, the Healthcare Value Hub, Best Buy Drugs, and a Choosing Wisely project. Let me tell you a little bit more about the Safe Patient Project. For those of you who aren't familiar, we are a campaign that's focused on ending medical harm through working for transparency and accountability. And our leader, Lisa McGiffert, she has been recognized by Modern Healthcare as one of the 100 most influential people in healthcare. And she is our campaign director. And just yesterday, she was awarded the Ben Schimberg Public Service Award in DC for her work to hold medical boards accountable and working with patient advocates. And Consumers Union Safe Patient Project works on everything from hospital infections to medical errors, doctor accountability, and medical device safety. We have a history of working on hospital-acquired infections, and this campaign has been active to pass 30 hospital infection reporting laws, which led to the national reporting of hospital infections. So now consumers can look up at their state's healthcare website what their local hospital's rate of infection is, which we think is a powerful motivator for hospitals to improve. And we think that antibiotic resistance is the most urgent healthcare crisis of our generation. And we're working to change that. We're working to make sure that consumers are aware of this threat. And most recently, in Consumer Reports' August issue, we had a cover story on superbugs where we highlighted the problem of antibiotic resistance and in terms of antibiotic overuse, looking at the healthcare system and overprescribing of antibiotics. But very powerfully, we featured two of our top advocates. We have Christian Lillis here and his brother Liam, and their mother died from a C. diff infection after going to the dentist for a procedure. And also Consumers Union, we've been active at the national level to monitor the President's Committee on Combating Antibiotic-Resistant Bacteria. We've also partnered with the CDC on the release of hospital infection reports. We also went to Congress recently and we lobbied for safe and effective antibiotics because we're concerned that with overuse of antibiotics, one day they might not be effective. And on the horizon, we're working to make sure that antibiotic use can be tracked by hospitals. And we think that this information will really spur hospitals to improve and stop overusing antibiotics. We also believe that superbug outbreaks should be reported promptly to the public and to public health authorities. And I want to tell you a success story that we had recently called the Lowdown Dozen. And this was an innovative way that we use social media and earned media to hold hospitals accountable for infecting patients. We actually used Consumer Reports' Healthcare Ratings Center to look at the hospital ratings across the country and identified the 12 low performers across 5 different types of infections. And we wanted consumers to know about these hospitals and to demand change. And so we used Twitter. We had a hashtag #SlamSuperbugs. We worked with our media department to make sure that we were pitching local reporters about our project and the hospital ratings. And ultimately, it resulted in getting responses from all the 12 hospitals on that list telling us what they were doing to improve. And we thought this was a great way to spur conversation. And it really resonated with our audience. We had a record-breaking amount of web traffic to that Consumer Reports article. We had over 38,000 social shares on social media, people talking about it in their communities. We had local media stories. And it really was a huge success that we plan on replicating the next time that we get hospital data from CMS. And perhaps our most powerful tool, clearly without a doubt, has been the Safe Patient Project Network. And this is a network of harmed advocates who are working hard to make sure that what happened to them or their loved ones doesn't happen to anyone else. And this is really the reason that I am most proud to work at Consumer Reports, getting to work with such passionate people like you'll hear from today. And these folks are the ones that are educating their communities about medical harm and the human impact of that. They're spokespeople, they're talking to the media on a regular basis, going to conferences, they're lobbying and testifying. They're also social media ambassadors and working to build relationships and spread awareness. And with that, I want to introduce two amazing leaders in our Safe Patient Network. These are David Antune and Jolene Chambers. Let me give you a little bit of background. David is from Ohio. He spent 4 decades as a professional military aviator until his career abruptly ended because of a medical harm nightmare. He contacted Consumers Union 4 years ago, wanting to see what could be done to make sure that healthcare institutions are held accountable. And Jolene, who's from Texas, she teamed up with Consumers Union in 2010 and has been one of our most active spokespeople on medical device safety. She witnessed her brother Stephen in medical and legal purgatory as a result of a failed elbow implant. And she started the Failed Implant Device Alliance. And I really hope that you'll listen to their stories and really take away something that can really help you make a change in your own communities and where you work. Thank you so much.